not just creatures, cars, and cruises, but everything that pertains to our life and godliness. That's what God says that he's going to do. He's going to provide for us everything that pertains to life and godliness. And so sometimes we spend so much time talking about, our spiritual walk, which is very important. Sometimes we forget that the spiritual revelation that we get is for practical living. Amen. Because you're not going to need any of that when you go to heaven. And so you need it all while you're here. And sometimes you don't know what you don't know until someone tells you. And so this month is, again, a very special time for us in Transforming Life Church. And so we just this is public service, not just for Transforming Life. So those of you who are viewing on Facebook and YouTube, please tag your friends and your co-workers and anyone that you may know that this information may be valuable to you. And so Latrice is going to take some time to share this information with us, and then we'll have a Q&A afterwards. Amen. And she only charges $2 a question. So I'm just kidding. No money. That's the first thing she said. I can't receive anything. All right. So without further ado, we're going to go ahead and allow her to start her presentation. So come on, clap your hands for Latrice Jeter. Thank you for coming.
So thank you all for welcoming me. Thank you to Pastor Chris and Pastor Kim. Just to tell you all a little bit about myself before I start the presentation. My name again is Latrice Jeter, and I've been in this industry over 20 years now. I started with United Healthcare as a brokerage account manager, and then a regional marketing manager, and then I left that company and went to Health Plan One, which is one of the largest field marketing organizations for Medicare specifically in our country right now, and helped them to grow that out from the inception of that company. So I stayed there for 10 years and then resigned I was the vice president of business development there, and then I resigned so I could get back out in our community and start my little agency and grow it out. So it's myself, and as of today, there's 7 agents that work along with me. Very appreciative of them and all their efforts as well. And so our goal is always just to go out and educate the community, support the community, and just be advocates for those that, are trying to figure out Medicare and Medicaid and everything that comes along with it. So we work with a lot of veterans, of course, those with disabilities, as well as our seniors and their children and their families, because, you have a lot of caretakers, as well with questions. So I welcome any questions and anything that I can help anyone with, after this meeting today. So I'll go ahead and get started. Slide 2. So the beginning of this presentation, I just kind of call it Medicare 101 or Medicare Made Simple. It's just to kind of simplify Medicare, because it can be rather confusing, and it's really not. It shouldn't be. For those that are new to Medicare or those that are caregivers, for someone who's aging into Medicare or newly receiving or going to soon be eligible for Medicare, we'll cover that first. Slide 3. So what is Medicare? It's just a health insurance program for those that are age 65 years and under. So once you age into Medicare, you just turn 65 and you then qualify for Medicare. It's also to be eligible for those that are under the age of 65 with certain disabilities. And so if you receive Social Security disability income for a period of 2 years, you just automatically qualify for Medicare, and a lot of people don't realize that. And then within recent years, they've also added if someone has end-stage renal disease or Lou Gehrig's disease, after a certain period of time, they automatically qualify for Medicare as well. It's administered by the federal government via the Centers for Medicare and Medicaid Services, that's CMS. And to enroll in Medicare, you go through the Social Security Administration or the Railroad Retirement Board program. So any premiums that are taken out usually come out of people's either Social Security check or their railroad retirement benefit checks. And slide 4. So there's 4 parts to Medicare. Part A is hospital insurance. Part B is medical insurance. And then Part C, you commonly see a ton of commercials over the years about. Those are the Medicare Advantage plans. And Part D is prescription drug coverage, or PDP plans, they're commonly called. And that would be standalone prescription drug plans, is Medicare Part D. And slide 5. So to actually enroll in Medicare, you're notified 3 months before you become eligible to Medicare. So I often get calls from clients and they say, I just all of a sudden got a Medicare card. I don't know why. And I say, welcome to Medicare. So they usually automatically enroll you into Medicare. If you're not automatically enrolled, you can just call in and request enrollment, or you can go online and request enrollment as well. And you have 3 months before the month you become eligible. You have the month of eligibility, and then you have up to 3 months after to go ahead and get enrolled into Medicare Part A and B once you're eligible. Part B is elective, and you must enroll 3 months before, the month of eligibility, and up to 3 months after. If you do not enroll during that time period, and you don't have creditable coverage or other coverage to qualify you as creditable, which would be something like employer coverage or veteran benefits or something like that. There's a list of different options. Then you may be subject to a penalty if you enroll at a later time. Most clients, if they're not automatically enrolled and they don't know to just call and enroll, it's usually because they have employer coverage or veteran benefits or something that will qualify them. But just for those that do receive the letter and they say, I don't want to start paying, this Part B premium, I don't want to, and I'll get into that in a minute. And they say, I don't want to pay that, I don't need that. Just so that you're aware, if you don't enroll when you're first eligible, you may very well be subject to a penalty at a later time once you do want to enroll. That's a sample of the red, white, and blue card. So that's when I get those calls randomly and they say, I just got the red, white, and blue card. And I'm like, I wish I had one. So I went over, there's 4 parts. You have Part A, which is hospital coverage. So what does Part A of Medicare cover? It covers blood, except the first 3 pints. It covers home health services. It will cover hospice care, hospital stays, as well as skilled nursing facility care. Some of the things that Part A does not cover, that people tend to think it will cover, or Part B, are things like dental, vision, hearing, unless it's certain situations, but just your standard, vision checkups and hearing checkups, original Medicare won't cover that, as well as prescription drugs, because that's its own standalone Part D. Part A coverage usually does not cost, meaning there's no premium, monthly premium. If you or your spouse paid Medicare taxes while you were working, there is a small subset of Americans that do have to pay a Part A premium, and it means they make a lot of money. So it's based on the cost of living guidelines and the federal poverty level guidelines. So Part A, the original Medicare payments, how Part A works is that for inpatient hospitalization, there is a deductible. That deductible is per benefit period, is how it's always worded. What that means is that every 60 days of a hospital stay, you have a deductible. So that would be per benefit period. A lot of people think of their employer coverage and think the deductible is just one time. It is not. For the year 2024, and these numbers change each year. They increase a little bit year over year for cost of living adjustments. This year, for inpatient hospital care, it's $1,632 deductible, and that covers you up to 60 days of a hospital stay. And then you would go to small co-pays per day after that. So days 61 to 90 is $408 per day. Days 91 through 150 is $816 per day. And then there's some additional costs depending on, the certain services that you receive during that hospital stay. So yes, I jokingly say small copays. Beyond day 150, your coverage runs out and you no longer have coverage. Days 91 to 150 are called lifetime reserve days. You get to use those days one time in your lifetime. So if you're ever hospitalized and you have to stay up to 150 days, your coverage is then done with original Medicare. You've used your lifetime reserve days. And then for skilled nursing care, that would be for a zero copay days 1 through 20. Days 21 to 100 for 2024 is a $204 per day copay. Notice it stops at 100. Again, with skilled nursing care, with original Medicare only, if you're there for 100 days, your coverage just stops. It no longer covers you after that point for that skilled nursing care stay. And again, it covers the first 3 pints of blood. Slide 8. I think I'm forgetting to say slides. I'm sorry. I hope you're following me okay. So then the Part B of original Medicare, when you think of Part B, you want to think of outpatient services or everything that doesn't happen in an inpatient stay. So that would be, emergency room, preventative visits, x-ray and lab, ambulatory care. You're either in a hospital setting or an inpatient overnight is a good way to look at that stay, and it falls under Part A, or you're not. And that's everything else, which would be Part B that is covered by original Medicare. So Part B helps cover medically necessary services like doctor services, outpatient care, home health services, and other medical services. It also covers some preventative services, and that would include emergency room expenses. Here's that nice chart that I had mentioned that determines who pays for what. So if someone for Part A, they look at your income from a couple years ago actually for Medicare. So this year in 2024, if 2 years ago your filing status on your yearly income was at $103,000 or below, then Part A was a zero premium. If you were at $103 or above, then you had a small premium, most likely that you would pay for Part A. The same is true for Part B. The average American in 2024 is paying $174.74 a month for Part B, which is your outpatient service. And those that are making $103,000, for example, up to $129,000 are paying $244.60. So that's just to show kind of the grid of those actual dollar amounts and how it would increase based on your income level. But again, vast majority of Americans this year is paying $174.70 in 2024 for Part B. I did a comparison up there. The $164.90 is what the Part B premium was for last year. So you can see it goes up each year traditionally, but not by that much. Looks like it went up about $10. And it'll go up again for 2025. And slide 9. So with Part B, the original Medicare coverage, there's some additional out-of-pocket costs. So you have the monthly premium of $174 this year and 70 cents. And then the deductible for Part B is $240 in 2024. That is an annual deductible, meaning the minute you use your Part B coverage for outpatient services, you get billed one time for the year of $240. A deductible is what you pay prior to the insurance kicking in and paying. So you pay the $240 out of pocket, and then that's the 80-20% that is commonly known about with original Medicare would be for Part B coverage. After that $240 deductible, Medicare is paying 80%, and you are being billed 20%. That's a co-insurance amount. So anytime you hear percentages, those are co-insurances. And that just goes on and on and on. There's no limit to that 20%. So what else you would be billed would be based on the amount of services that you have rendered for that year. Slide 10. So just to kind of recap that so far, there's 4 parts to Original Medicare. You have Part A is primarily hospital expenses. Part B is the outpatient care. Part C is a Medicare Advantage plan. And Part D is a standalone prescription drug program. There's a lot of letters when it comes to Medicare. So those 4 letters, please don't confuse with what is known as Medigap or Medicare supplement plans, because they also have letters A through N, and I'll cover that here in a little bit. Slide 11. Medicare supplement plans are not the same as Medicare Advantage plans. And before I go into some details about those, I'll explain why. Because I often have clients that say, I want a supplement plan. And I start discussing supplement plans, and they say, that's not what I want. I don't want that monthly premium. So what a Medicare supplement plan is I went through Original Medicare and some of the cost of that. A Medicare supplement plan pays after Original Medicare pays, and it's that simple. So if Original Medicare doesn't cover it, neither does a Medicare supplement plan. There are monthly premiums for a Medicare supplement plan as well, and I'll go into more details, but that's just kind of an overview of how a Medicare supplement plan works. It pays a portion or all of the cost after and only after Original Medicare covers or pays for something. Medicare Advantage plans, however, those are the ones you see the commercials about. They're typically 0 or very low premiums. They pay instead of Original Medicare. So Medicare supplement plans are through a private insurer. So are Medicare Advantage plans. You must have Medicare A and B for both of them to qualify. A Medicare Advantage plan will replace, when it comes to claims payouts, it would pay instead of Original Medicare paying. And slide 12. So some major differences between Medicare Advantage and Medicare supplement plans. With Medicare Advantage plans, they have very low monthly premiums. Some are as low as 0. All the rates are the same regardless of age or sex. So the rate is the rate based on the plan and the zip code. Many of them include Part D prescription drug coverage. So with Medicare Advantage, you're getting Part A, Part B, as well as Part D often included. They do have plans that don't include prescription drug coverage as options available as well. And they are guaranteed issue. What that means is there's no medical underwriting. The only thing to qualify for a Medicare Advantage plan is you must qualify for Original Medicare Part A and B and be enrolled in Part A and B, and then you qualify for a Medicare Advantage plan. They're not looking at health issues, I should say, when I say there's no medical underwriting. There are co-pays for treatment under a Medicare Advantage plan. So for example, if you go to a primary care doctor, you might have a small copay of maybe $0 or $15. Go see a specialist, another small copay of maybe $30 or $40. It depends on what plan you choose, what the actual copays would be. One of the benefits to a Medicare Advantage plan is what's called a maximum annual out-of-pocket. So if you're looking for or shopping around for a Medicare Advantage plan, it's super important that you want to find out what is the annual maximum out-of-pocket cost for that plan. And what that means is that, let's use an example of a plan with a $2,500 out-of-pocket maximum. It means that once you hit this amount, you stop paying for your services rendered for the year. You stop paying co-pays and things like that, and the plan then covers you 100% the remainder of the year. So notice when I was going over Part A and Part B, those expenses just keep going. So a Medicare Advantage plan would ensure that you have a maximum amount that you would be responsible for the calendar year before you're covered 100%. The benefit structures vary by plan, so each plan is its own plan. It could have a different deductible, a different annual out-of-pocket maximum, a different copay, different types of coverage in it. And then the plans must be approved by CMS. Medicare Advantage is overseen by the federal government. And they have lock-in periods, which restrict when you can and cannot enroll or disenroll from a Medicare Advantage plan. They also have networks with Medicare Advantage plans. Most commonly here in Indiana, you have HMO, which is Health Maintenance Organization. That means you want to remain in network to be covered by your Medicare Advantage plan, with the exception of emergencies and urgent care. By law, you can just go anywhere. It's always covered as if you're in network. The other option that is most common here in Indiana is a PPO, and that stands for Preferred Provider Organization Plans. So that gives you the option to stay in network and pay the lowest price, or go out of network and you just pay a little more in those co-pays and out-of-pocket costs if you step out of network, but you're still covered. So that's just kind of an overview of how the Medicare Advantage plans versus the Medicare supplement plans. Remember, Medicare Advantage pays instead of original Medicare. Another thing to note with Medicare Advantage, I'm commonly asked, well, will I lose my Part A and B since I take this Medicare Advantage plan? Again, you can only qualify for a Medicare Advantage plan if you have Part A and B, and you do not lose any benefit. By law, all Medicare Advantage plans have to cover at least what original Medicare would cover, Part A and B. So you're only gaining in benefit by enrolling in a Medicare Advantage plan. They throw things into the Medicare Advantage plans as well, such as dental, vision, hearing coverage, and a host of other things nowadays, over-the-counter benefits and things like that. The other option is the Medicare supplement plan. Remember, they pay after original Medicare A and B, so a Medicare supplement plan covers exactly what original Medicare covers. They have monthly premiums that typically range from $150 to $250. This is, I'm licensed in multiple states, so here in Indiana, the average monthly premium is usually around $125 to $160 for a new enrollee into Medicare supplement. The rates do frequently increase as you grow older because Medicare supplement rates are gender distinct. So a male might pay a different amount than a female. Whether or not you use tobacco is taken in consideration. Your health conditions can even be taken into consideration when they're pricing you for a Medicare supplement plan, meaning those plans are medically underwritten. There's an exception. When you first turn 65 years old, you have 6 months to pick out and enroll in a Medicare supplement plan, and you cannot be medically underwritten. So no matter what health conditions you have, the rate is the rate, and they're just gonna enroll you in the plan. They can't increase your rate based on those conditions or even consider your health. After that 6-month window closes, all Medicare supplement plans are medically underwritten. And so they can either deny you if you apply, they can rate up, which means we offered you $120. Now that we saw your medical history and what prescriptions you take, we're gonna charge you $160 if you accept the policy. So that's an example of how underwriting works. There's other situations where Medicare supplement plan cannot be medically underwritten, such as when you're leaving a group plan. So again, if you have creditable coverage, a lot of those rules are waived to give you an opportunity to enroll. Or if you're rapidly disenrolling from a Medicare Advantage plan. Those that leave a Medicare supplement and try out a Medicare Advantage plan have a 12-month window. If they don't like the Medicare Advantage plan, they can go back to the same exact Medicare supplement plan that they had, and it cannot be medically underwritten. So they give you window. There's a little booklet of a bunch of other reasons, but those are some of the most common examples. For Medicare supplements, covers remainder of provider bill after Medicare pays on most popular Plan F. The most popular Plan F paid 100% after original A and B paid. You can enroll in it now if you're new to Medicare after 2020, January 1st. Anyone who had or has Medicare A and B prior to January 1st, 2020 can still enroll in a Plan F that pays 100%. So the most popular plans now, today, are actually a Plan G and a Plan N, like Nancy. And so they don't pay 100%. you have to pay the Part B deductible before your coverage kicks in, and I'll show those plans. And then Medicare supplements are standardized benefit plans. So there's letters A through N for Medicare supplement, and the plan is the plan. It can't be changed by an insurer. It's standardized by the state. It's the state and federal government working together to oversee the Medicare supplements. The only thing that can be different is the monthly premium, just what you pay for that plan. So for example, a United Healthcare Plan N is the exact same plan as an Anthem Plan N, like the plan is the plan. What's going to differ is what they charge you for it. They're guaranteed renewable plans, meaning once you get your Medicare supplement, if you fall ill later, they can't then medically underwrite you. As long as you're paying your monthly premium consistently, they have to cover you. And beneficiaries can enroll throughout the year. There's no special time frames for enrollment. And Medicare supplement plans have no networks. So as long as a doctor accepts Medicare, you can go to them with the Medicare supplement. Slide 13. So Medicare Advantage and prescription drug plans. Slide 14. For original Medicare, for Medicare Advantage, you must be on original Medicare Parts A and B for a prescription drug plan. You just need to have either Part A or Part B to qualify for a standalone prescription drug plan. You must live in the service area of the plan that you're enrolling in. There's something called dual eligibles. They have dual special needs plans available for those that are on Medicare and Medicaid. So that's noteworthy because they have a ton of more benefits that they put into those plans for those that do have both Medicare and Medicaid. So the state is then working with the federal government as well as the private insurer to offer more coverage on those plans. There are special enrollment periods for Medicare Advantage. We're coming up on the biggest one of the year, which is annual election period. Everyone can change everything that they have is the easiest way to explain that. It runs October 15th is when enrollment starts, and that period ends December 7th, which starts a lock-in period for Medicare Advantage plan. The initial coverage election period is that 7-month window. When you're first eligible for Part B, you can 3 months prior, the month of eligibility, and 3 months after, you can enroll in a Medicare Advantage plan. Another time you can enroll in a Medicare Advantage plan is a special election period. Special election periods just means there's a special reason, like you left your employer plan, so now you have a special election period. Or you move, you're living in one zip code and you move to a different zip code. Well, then you can enroll in a plan. And there's a small booklet of reasons for special election periods as well. That just means you can enroll throughout the year versus being locked into the plan. And then there's also a new open enrollment period, which is fairly new. It's only been available for a few years now. That period runs January 1st through March 31st. And the only people who can change Medicare Advantage plans during that January 1 to March 31 period have to currently be enrolled in Medicare Advantage plans. So it gives you another 3-month window only if you already have a Medicare Advantage plan to switch out to a different Medicare Advantage plan or to disenroll and just fall back to original Medicare A and B. Slide 15. So eligibility for the standalone Part D plans, again, you have to be enrolled in either Part A or Part B to be eligible for original Medicare Part D. And you must live in the service area. There is a penalty as well for prescription drug plans. Anyone who is Medicare eligible, whether you have Medicare, whether you choose to enroll in A or B or not, once you become Medicare eligible, if you are not enrolled in a creditable prescription drug plan for a period of 63 days or longer, at any point in time, from the time you qualify, forever, if there's ever a 63-day period or gap in prescription drug coverage, you have a 1% per month penalty that applies once you're eligible. A lot of people don't realize that. They're young, they're feeling good. They say, I don't need, prescription. I don't take anything, Latrice. And good job. But at the same time, I always recommend just take the lowest price prescription drug plan in your zip code then. Take a $10 prescription drug plan, $8, $12, because that will avoid that 1% per month penalty, which just snowballs and adds up over time. So I'm meeting with the client who is 81, and they tell me, I've now felt ill. I haven't had prescription drug coverage all these years. I just take my vitamins. You know, I get, allergy pill or antibiotic here and there. You can only imagine 1% per month compiled over time is a pretty penny. So that Part D prescription drug penalty never goes away. Once you later decide to enroll in Part D, if you weren't already enrolled, you have that penalty applied forever. And it's based on the national average premium amount. Slide 16. So the Medicare Advantage and prescription drug plans, they are heavily regulated. We as insurance agents and brokers must be contracted, certified, and state licensed and appointed to discuss or enroll beneficiaries. You must offer more than or at minimum equal to original Medicare I discussed on a Medicare Advantage plan, so you're not losing any coverage, you're only gaining. And remember, the annual maximum out-of-pocket is a key feature. What we do as agents and brokers, an agent just means you represent one company. So if I were a captive agent, that would mean I work for Anthem. I only can offer you Anthem. As a broker, I represent all the major carriers and regional carriers and a lot of the smaller carriers available in the state. And so how we help at my agency is we search the formularies for you, we search the networks for you, we explain the different plan options, and nowadays we can just kind of load that stuff in the system and make a recommendation of the plan that's going to have the lowest out-of-pocket cost and the most benefits or features that you're most interested in or that will best meet your specific needs and budget. So even in households, I always tell and have to explain to spouses, I may not recommend the same plan for you that I recommend for your wife or vice versa. We're going to always recommend the plan that best meets their specific needs and budget. A lot of people ask me, so I'll just cover that. You might wonder, why do I get all this extra coverage for no premium? If you do happen to have a Medicare Advantage plan or you're looking into one, they say, what's the catch? So there is no catch. What's happening is you're paying a monthly premium, remember, Part B to the federal government. Don't forget you had to have Part A and B. They're just then sending that money over to the private insurer. So you're paying for it, trust me, in a roundabout way. The other thing is the federal government, of course, gives a pool of money or grants to these private insurers for covering Medicare eligibles under their Medicare Advantage plans. The private insurance companies do a much better job of insuring people because they're insurance covered, companies than the federal government does. So they can throw a bunch of extra benefits in and things like that because most of the private insurers as well don't just only offer Medicare Advantage plans. They're offering multiple lines of business like small group, employer coverage, individual health care, short-term health care, dental, vision, hearing. So they're sitting on a pool of money. And they can throw in all those extra benefits to remain competitive. So that's why they do that. But again, it's a zero premium plan most often, but you are still paying your Part B premium. And I mentioned all the extra benefits. They usually include dental, vision, hearing, gym memberships, over-the-counter benefits, that list goes on, transportation and things like that. Slide 17. And so Medicare supplement plans are pretty easy. I kind of went through all of this. They cover the gaps in original Medicare. That's why they're also known as Medigap plans. Again, they pay after original Medicare Part A and B. They cover what original Medicare Part A and B covers. They do not include dental, vision, hearing, or prescription drug coverage. So if you get a Medicare supplement plan, especially, please remember to pick up a standalone prescription drug plan as well, even if you don't currently take prescriptions, so that you avoid the 1% penalty later. They're year-round enrollment, so Medicare supplements are pretty easy, and no networks. Slide 19. I covered that already. To be eligible for Medicare supplement, it's an open enrollment period, no underwriting for the first 6 months that you are eligible. After that, you're medically underwritten. You must be enrolled in Medicare Part A and B to enroll in a Medicare supplement plan. In the state of Indiana, you must be age 65 or older to qualify as well for a Medicare supplement plan. With a Medicare Advantage plan, as long as you have Part A and B, regardless of your age, you qualify. With the Medicare supplement in Indiana, this is not true of all states, that varies by states. The plan eligibility is for 65 and up currently. That could change year over year. During the 6 months, you can't be denied for a Medicare supplement plan. And then slide 20. And I've already covered that, so those on Zoom can just kind of read through that. And then slide 21. For medical underwriting with Medicare supplement plans, when you do apply, if it's not within the first 6 months, some of the questions you'll be asked is your health questions, your height and weight. They're going to look at your medications. They're going to consider, do you use tobacco or not, and any pre-existing conditions. There's something called pre-existing condition clauses I get asked about. Well, I explain that up front if someone's not in their guarantee issue period. So if you are enrolling later, after the first 6 months you're eligible into a Medicare supplement plan, please be sure to check your policy and ask your agent or whoever you're working with about any pre-existing conditions, because they can approve you, and in the fine print, the policy that most people don't open, they just kind of get that and file it away. They may have a clause in there that limits or excludes exactly what you need coverage on. So it may say for the first 12 months, we won't cover this medical condition specifically to you that we know you have right now. Or for the first 6 months, we will not cover this specific medical condition for your specific policy. So please always ask your agent or whomever you're working with, or read it yourself, and keep an eye out for any pre-existing condition clauses, and that's literally what it says in the policy. So just look for that section and check out if you have any limitations or exclusions, so that you're not paying for something and go to use it 3 months in and find out I'm not covered on that condition right now. Page 22. That's for under age 65. We can go to 23. That doesn't apply here in Indiana right now. So the Medicare supplement benefits chart, it hasn't changed in quite a while. This is what it looks like. So you can see there's plans A through N. Plan F that covers 100%, you can see all the way down the column. There's what Part A and Part B covers on the left side there. You got your Part A coinsurance, Part B coinsurance, the first 3 pints of blood, Part A hospice care, skilled nursing, the Medicare Part A deductible, Medicare Part B deductible, and then Medicare Part B excess charges. That is the Plan F, that covers everything 100%. If you are eligible for Medicare, again, after January 1st, 2020, you do not qualify for a Plan F. So the next most recommended plan would be a Plan G, which you can see covers 100% of everything except the Medicare Part B, as in boy deductible. And for 2024, the Part B deductible is $240, and that's a one-time annual deductible. So you would be billed $240 one time, and then you're covered 100% the rest of the year. The third most popular plan is the Plan N, like Nancy, to the far right there, and you can see that covers 100% of excess charges, with the exception, again, of that Medicare Part B, as in boy deductible. That was $240 this year. And the Medicare Part B excess charges, it does not cover as well. Slide 24. Medigap plans F and G are now offered as well as high deductible plans by some insurance companies in some states. If you choose the high deductible options, again, you pay a deductible and then the coverage kicks in. So a deductible means this is what you pay prior to the insurer paying. In slide 25. And I covered that, the new macro law, plans C and F. Plan C is not common, but plans C and F are no longer options if you turned 65 on or after January 1st, 2020. And so now plans F and G, they also offer a high deductible plan option. And once that deductible is paid, plans F and G are the plans that pay 100% of covered services for the remainder of the year. And slide 26. So, if you're wondering, what do I buy? Do I buy a Medicare Advantage or a Medicare Supplement plan? It just depends on your budget, your specific needs, and what's going to work best for you and your situation at that time whenever you're speaking with an agent or meeting with someone to make that determination. My agency, Simplified Insurance Solutions, we offer from Medicare supplements to Medicare Advantage plans. We offer the standalone prescription drug plans, standalone dental, vision, and hearing plans, hospital indemnity plans. We offer additional senior-focused benefit and coverage options, ancillary products, life insurance, long-term care, things like that, final expense. So feel free to reach out. You don't have to be looking to switch plans or purchasing anything to reach out to us. If you have questions, we welcome that. Because again, our goal is just to educate first. And then slide 27. And I already covered that. I'm currently licensed in 10 states. At one point, of course, I was licensed in all 50 states. And so once I started my own agency, that cost a lot of money to renew all those licenses. No, and also I started with just me. So my focus right now is truly just Indiana, and I kept other state licenses, the ones with the most retirees in them, so that my goal is to eventually grow my agency out. And then I explained to you all how we help, and that's up there as well. And slide 28. And there's my contact information. My cell phone is there as well. If you have any questions, you can always feel free to just call my cell phone. My email is ljeter, that's LJETER, at simplifiedinsurancesolution.com. My office is over at Fort Benjamin Harris area. It's right across the street from Panera and the Social Security office, and right there with a bunch of veterans in front of the YMCA. So I do a lot of community service, of course, and hopefully you all see me around after today.
Wonderful, wonderful. Come on, let's thank we're going to take a few moments for Q&A. Does anyone have any questions they'd like to ask? Well, come on here, fellow. Put you on camera there.
Okay, I just turned 65, and I applied for Humana. Now, I don't know all the ins and outs. What can you give me that will be different from them, or vice versa?
Do you have a Humana Medicare Advantage plan or supplement? A Medicare Advantage? The carriers that we offer range from Humana to Anthem, United Healthcare. I offer Cigna, Zing, that list goes on, Aetna. Now you specifically, we would meet and I would sit down and go through your list of prescriptions that you take, the name, dosage, and frequency of each. We would go through your specific doctors that you want to visit and frequent and hospital environment to determine what type of network will work best for you.
Well, mostly I do all my
Okay. So you said most of what you do is at the VA?
I do it at the VA.
Mm-hmm.
All my medical and all my medical stuff is at the VA. I don't go outside the VA. I don't go to no private doctors or nothing like that. So I have a paper trail.
Okay. Yeah, and so how we typically, how those Medicare Advantage plans specifically help veterans is exactly what you just said. A lot of veterans, what if you want a second opinion? Then it gives you the right to go anywhere in that network. Humana is the second largest insurance carrier for Medicare in the country. If you took a Humana PPO plan or an HMO, you now have access to their national network. It's the second largest Medicare network, second to United Healthcare. So if you're away and you're visiting some family or you're on a trip, you have that entire network to frequent. You now have emergency and urgent care as if you were in network anywhere throughout the country. And the biggest aspect to that to me, or plus for you, is that it opens you up to Humana's network. Now you can go to community or Methodist or any of those different hospital settings that you want to go to. As long as it's in their network, you can go to it. And I know with a lot of veterans, you have your prescriptions probably getting them through the VA too. All prescription drug plans, including veteran coverage, have what's called a formulary. So that's a list of here's what we'll cover versus anything not on this list we won't. The VA formulary is extremely limited compared to a United Healthcare or a Humana. You can imagine they're the largest carriers in the country. It opens you up to those formularies as well. So if you took a plan that includes prescription drug coverage, you now have the option to stay at the VA, but anytime you go and they say, we don't cover that, go back to your doctor and get it switched out to this that we do cover. Also remember to check your Humana plan. Most likely it's covered under Humana.
So will I need the help or what they call it, the G or?
No, remember those are Medicare supplement plans. So those letters A through N, it's two different types of options. So you have original Medicare Part A and B, as well as your veteran coverage. That all stays intact. You don't lose any of that coverage. What you picked up in addition is a Medicare Advantage plan. All it's doing is providing you with even more coverage at a zero premium to you. And then you have things with your Humana plan like over-the-counter benefits. You have transportation benefit. There's a lot of extras that are thrown into those plans that you might not have had through veteran services or original Medicare alone. So you've only gained. You cannot have both a Medicare Advantage plan at the same time as a Medicare supplement plan. It's kind of like double dipping. So you have to choose either a Medicare Advantage or a Medicare supplement. With you having veteran coverage as well as original Medicare, I wouldn't recommend a Medicare supplement to you. You'd just be paying extra money for coverage that you already have. Your Medicare Advantage plan through Humana is most likely a zero or very, very low premium. You should keep it. Yep, I wouldn't recommend you leave unless there's a specific reason.
Anyone else have a question?
I'm under 65, but I get Medicare. I have all so I don't have any complaints as of yet. But is there any other services that I should look for to get a better? Some insurance, some supplementals would do the food and stuff like that. Well, for me, I don't get that. I don't get that.
It sounds like with Allwell, you have an Affordable Care Act plan. I'm licensed also and offer individual and family health plans. That's through the federal marketplace, also known as Obamacare. And I say that we all know what Obamacare is. If you're under 65 and you have Medicare, as long as you have both Medicare Part A and B, you qualify for a Medicare Advantage plan. You just weren't aware of it.
They don't offer it to, they give me, so with mine, I get a card, $60 a month, so I can get over the counter medicine.
Mm-hmm.
But they have other plans for certain people to get, groceries.
Mm-hmm.
I can use my card to get those groceries.
Yeah, you're talking about the over-the-counter benefits that include, going to Walgreens and shopping and your pharmacy, the things that aren't prescriptions, the actual over-the-counter things. Most of them include grocery benefits. You can pick your electric bill, gas bill. They'll even pay for a utility. What you're describing is a Medicare Advantage plan, and it sounds like you're currently enrolled in an Affordable Care Act plan, and you just might not have been aware that you qualify for a Medicare Advantage plan. So I would love to meet with you and let you know all the benefits that you're eligible for, and get you enrolled. Yeah. Thank you. Okay.
Okay, is there anyone else that has a question? Oh. That might have been the issue. Testing. Okay. Is there anyone else?
And just to recap that last question for those not present here with us, she was asking, under the age of 65, but has Medicare A and B, and so she had a current all-well plan, which tells me that it's an Affordable Care Act plan or a federal marketplace plan. And again, she just may not have been aware that she qualifies as well for a Medicare Advantage plan. And so that was that prior question.
Okay, I have a couple of questions. Most of the ones that I had outlined, you've already covered in your presentation. Should a person sign up for Medicare Part B if they're veterans? If they already receive veteran benefit? I think that's similar to Brother Gerald asked, but I think he says he has all of them already, so.
Yes, most veterans actually do have Medicare Part A and B if they qualify. So they are disabled and under the age of 65 and qualify. Most veterans are already enrolled in Part A and B. Once they reach the age of 65, they automatically qualify. The reason many veterans, I guess, choose to enroll in Original Medicare is, again, it just gives you additional coverage in addition to the VA. It allows you to then go and see doctors outside of the VA. If there's a wait time or you want to get a second opinion or something like that, even with just Original Medicare Part A and B, it just opens you up to being able to seek care outside of your veteran benefits. So yes, in most cases, we would recommend that veterans are also enrolled in Original Medicare Part A and B. Sometimes veterans say, I can't afford Part B. That's common too. So because Part B this year is the one that's outpatient services again. The monthly premium is $174.70 a month this year. However, when I hear something like that, we're aware of a lot of benefits that most people aren't aware of. And so if someone tells me I want Part A and B, but I don't think I can afford it, then we have a discussion with them about Medicaid and a lot of state programs and state assistance programs, because they may very well qualify for Medicaid. If you qualify for Medicare and you qualify for Medicaid, Medicaid then picks up all of your out-of-pocket costs for Medicare. So I first get them enrolled in Medicaid, and then I can enroll them, suggest that they go to Medicare and get enrolled in Part A and B, and the state is now paying that out-of-pocket cost for them. Once you get Part A and B with the state paying for it, you then qualify for what's called a dual special needs Medicare Advantage plan, and that just increases the benefits exponentially. Like, it's a lot of benefits and a lot of extra benefits. There's also low income subsidy programs, where it's known as extra help, to help people with prescription out-of-pocket costs that they're not aware of that they qualify for. The low income subsidy program is not based on your income. There's also state pharmaceutical assistance programs that clients aren't aware of, not solely based on your income. It's looking at what is your income versus your prescription costs. So it's not just, here's a chart and you can cross it and qualify or you don't. They want to see, what are you paying out of pocket for all of your prescriptions. So we have clients that make a very nice income that also qualify for these low income subsidy and state pharmaceutical assistance programs. They're just not aware that those programs are available. So we help with a lot more than just Medicare Advantage and Medicare Supplement.
Wonderful. I think that kind of segued right into the other question is there any help for anyone that can't afford health care?
Yes, and that would be Medicaid, low-income subsidies, state pharmaceutical assistance programs. The state has a wealth of programs as well, such as SACOA. We tie people into, once you have a Medicare Advantage plan and you reach a certain age, now you qualify for a Pathways program. We're just compounding benefits that people just aren't aware that they qualify for at no cost to them. So,
Did y'all hear that? Did y'all hear that, Facebook and YouTube? All right.
and our services as well, I don't charge a dime for my services, and no agent, insurance agent, or broker should ever be charging you. That is illegal. It's no different than when you get your homeowner's coverage or your auto coverage. You pay the insured, never us. So
Awesome.
We're just here to help. We get paid by the insurance companies. I work for all of those insurance companies and represent them, so they pay me.
One last question. Are you stuck with the same plan forever, or is there a penalty for changing plans?
Yeah, I went over the penalties. You have a Part B penalty if you don't enroll when you should. You have a Part D prescription drug penalty if you don't enroll when you're eligible, or you don't have creditable coverage. That's the key. If you have something, an employer plan or employer prescription drugs or veteran coverage or veteran prescription care, then you have creditable coverage. Those are two examples. But if you just don't have anything, yes, the government will penalize you once you do finally need something and you decide to enroll. Outside of that, to switch from plan to plan, there's no penalties I can think of. With the Medicare supplement, some people consider medical underwriting a penalty because they might raise your rate a little bit, but that is not a federal government penalty per se. That's just, we're considering, your medical issues and health issues to determine what we're going to charge you. Kind of like life insurance, they do the same thing. They medically underwrite for life insurance as well.
Come on up. Sorry.
That's all right. Now, what if I decide to change from Arwell? Will I still be able to have the same medical team that I have?
Absolutely. You would, if you decide to go from Affordable Care Act, whatever plan you have has a network. It's either a PPO or an HMO. So with an HMO, that means you have to remain in All Wells Plans network. With the PPO, you can go in or out of network and be covered. We would do the same thing by switching you to a Medicare Advantage plan. So again, we search all of your doctors and hospitals. I would never meet with a client and switch them out in any plan without saying, I need to see a list of your doctors, your hospitals. If they just don't have that, or they say, I don't care which reason, I'll go see anybody, then I'm going to put them in a PPO plan. And then it doesn't matter. You can go in and out of network and still see every doctor and hospital that you want to frequent and still be covered. What you can't do is have a Medicare, it's kind of, you have to pick one or the other since you qualify for both. You know, Affordable Care Act coverage is for those under the age of 65 solely. But you happen to be under 65 and have Medicare that you qualify for. So you can either have a Medicare Advantage plan or you can have an Affordable Care Act. You just can't have both because it's kind of considered double dipping.
Okay.
But now that you know you qualify for a Medicare Advantage plan, not only would I review your Allwell plan with you and make sure you understand here's the benefits and all of the coverage on your current plan, we would do the same thing with the Medicare Advantage plan. We just educate, but you would be making the decision. But
Okay.
it makes more sense for me to switch to this Medicare Advantage, or I should stay with Allwell. Now, when I will make a specific recommendation is I don't think it's a good idea for a client to switch, then I absolutely tell them, don't switch, and here's exactly why.
Okay.
Yeah.
Thank you.
Anyone else? If you haven't, in my thought process, just from listening to the questions and everything else that's Latrice has presented to us, sounds like it would be a good idea to have health analysis done, or your situation if there has been some changes or change of jobs, or even interested in different types of programs or whatever. But she said that they do those analysis for you without any cost. And so if you have any more questions after tonight, and I need to put this disclaimer out there, we are not invested in their organization, and we're not receiving any funds for anything or any transactions, okay? So I think I just needed to say that just so, because it's going all over. But I would encourage you, though, if you do have any questions, to reach out to them for an analysis, and you may learn something that you didn't know and save yourself some money as well. Let's thank Latrice again for being with us tonight. Hallelujah. Thank you so much. Yes. Thank you so much. And as we close the program out, of course, we'll be doing this all month on Wednesday nights, and she'll be back with us next week for, I forgot what you're going to cover next week. Prescription drugs, that's always a big one. So go ahead and put that on your calendar and encourage someone to come by, especially if you know someone that may need a prescription plan or whatever. This is the month of the family, so we just want to bring this public service information out. It's free of charge. Those of you who are viewing with us on YouTube and Facebook, thank you for being with us tonight. We don't take that lightly. And of course, I would be remiss without giving you an invitation to come and worship with us on Sunday morning at 10:30 a.m. 4626 Wentworth Boulevard, Indianapolis 46201. That's 4626 Wentworth Boulevard, Indianapolis, Indiana 46201. Thank you for being with us, and good night, everybody. Come on, give the Lord a hand of praise. Thank you so much. Great job.